cases of community transmission, 7 directly linked to the Avalon cluster, 2 under investigation. One of those 2 does live on the northern beaches, and the other one is someone who works in the CBD, and Dr Chant will provide greater detail about how her concerns about making sure we don't have an emerging cluster by people working in the CBD or having frequented certain venues. So we please ask everybody to make sure you keep looking at the health website or the New South Wales Government website, which lists the new venues that are coming online. If you've been exposed at any of those venues, depending on whether you're a close contact or not, you need to get tested and stay home for 14 days. And can we say at the outset that it's so important for people who are in isolation for 14 days that you do that for 14 days. You might be negative until day 11 or day 12 and then you're positive, because we know that's how the disease works. So if you've been asked to stay home for 14 days, please do so. And we know how hard it is over Christmas. We know how hard it is over Christmas, but please don't visit anybody that's in isolation. And if you are in isolation, please don't have contact with anybody outside of your household, because that could, again, pose a risk to the cluster, to a new cluster emerging, which we certainly don't want. But can I firstly say how proud I am? I nearly fell off my chair, literally, when Dr Chan and I and others realised that 60,000 people came forward to testing to 8 p.m. last night. That 60,000 people in one 24-hour period is beyond outstanding. Can we thank everybody for responding? I especially want to thank not just the people taking the swabs, but also the pathologists who are working 24/7. I've had people tell me they're getting their test results at 3 a.m. and 4 a.m. It's a 24/7 job, but that's what's allowing us to stay on top of the virus. So the best thing we can do is to support their efforts by coming forward and getting tested, even with the mildest of symptoms. And can I stress to people, if you happen to develop a symptom on Christmas Day or Boxing Day, please go and get tested. We will have 300 clinics across the state, private, government, pathology testing units working throughout the night, private and public. Our health people and the supporting pathologists have just been amazing. So even if you get a symptom on Christmas Day or Boxing Day, please go and get tested. Do not wait till the 27th, because if people wait, you could be unintentionally infecting people and ruining Christmas for those closest to you. So our message strongly is please get tested no matter what day it is. And given the response and the feedback, people are getting their results in a couple of hours, within half a day. So please make sure even that getting tested and staying isolated for that period of time means that all of us can stay safe over the next few days. Now, the strongest advice that our health experts will give you about the next few days is please limit your mobility. Please do not move around unless you have to. We appreciate that there are restrictions in place which allow people to have people into their households, but please make sure all of us reduce our mobility, apart from those close family gatherings, which we've allowed over the Christmas break. We don't want people moving around unless you absolutely have to. Every health expert will tell you the greatest way the disease spreads is by people moving around too much and having contact with one another. So it's really important to reduce your mobility, limit your activity to those close family gatherings. Don't do anything you don't need to do. And please, of course, if you are in contact with people, make sure you're socially distancing. If you're in an indoor setting, please make sure you're wearing a mask and make sure you're using hand sanitizer at all times. So we need everybody to be extra COVID safe over the next few days. Don't let the celebrations or the Christmas activities reduce the necessary nature in which we have to be on guard. So again, can I stress, don't do any activity unless it's necessary, and we appreciate there'll be small family gatherings, small gatherings with loved ones, but even then all of us have to be extra COVID safe. You don't want to give the disease to people you care about the most, and we have to be on guard. But the testing results are beyond amazing and encouraging. We need to keep it up. So our strongest message is please get tested no matter what time of the day, no matter what day you feel the onset of this symptom, or if you've been determined that you're a close contact or a casual contact. Make sure you keep looking up the website, looking at all those venues that have been identified as someone with the virus having been there. And if health says you're a close contact, that means you have to take a test and you have to stay home for 14 days. If you're a casual contact, follow the health advice. And also, as a precaution, make sure You continue to look at the information available on the times that those venues were deemed to have someone infectious there and whether you were there just prior or just after those events. It's really important for everybody to do that. At the moment, the results, given the number of tests and given the number of cases, they're positive, but of course we need to keep seeing those case numbers go down. We still know that the virus is circulating in parts of the community, and I want to thank everybody for your patience, but also the way in which the community has responded to the messages we've been giving, and that has to continue. Dr Chant, especially in our briefing today, has highlighted to me, and she'll emphasise this as well, we are concerned about people who may have been infectious, who went to work in the CBD and then have passed that on to other people in the CBD, and those people have then passed it on back in their communities. They're all eventually linked to the Avalon cluster, but it does mean there's potential chains of transmission that we're not on top of, and that is a concern, and Dr Chant will provide further detail around that. So I just want to say thank you to everybody for your vigilance. My strongest message is we are far from out of the woods. We're not out of the woods by any stretch, and in fact we have to be extra vigilant over the next few days. We have to make sure we get tested with the onset of symptoms. We have to make sure that if we're isolated, we stay in isolation. We need to make sure we don't visit people in isolation. And we also need to make sure that as much as possible we reduce our mobility. We don't move around. We don't do things unless we absolutely have to make sure that all of us get through this period as safely as possible.